Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca. Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. The Spark theme for June is Child and Youth Mental Health, and I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made in shaping and strengthening this community, our province, and the country. We're delighted today to speak with Katelyn Bryant to bring you Child and Youth Mental Health, Parental Concerns about Children's Learning, Development, and Mental Health. Before we begin, we invite you to answer a few quick poll questions for us. Please note that you'll have to answer all three questions prior to submitting your response. And while you're responding, thank you so much for doing so, I'd like to introduce our speaker. Katelyn Bryant is a registered school and clinical psychologist practicing with children, youth, and families. She's a supervising psychologist and assistant director at the Mary J. Wright Child and Youth Development Clinic. She obtained her Master of Arts and her PhD in school and clinical child psychology from the Ontario Institute for Studies in Education at the University of Toronto. Her experiences working closely with youth, parents, educators, doctors, and other stakeholders in diverse school mental health and developmental service settings have solidified her commitment to interdisciplinary collaboration, innovation, and translating evidence to practice in accessible ways. It's now my pleasure to pass the mic to Katelyn.
Thank you so much for the warm welcome, and thanks everybody for joining to have some discussion about parental concerns about children's learning, development, and mental health. So just to give a little bit of context, I am a school and clinical psychologist working with school-age children with learning, development, and mental health and behavioral needs. And I work at the Mary J. Wright Child and Youth Development Clinic in London, Ontario at Western University, which I acknowledge is located on the traditional territories of the Anishinaabe, Haudenosaunee, Lenape, Chinantan, and the Chinantan Nations on lands connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. And as we're going through the talk today, I think it's helpful for us all to just reflect on the applicability of the content to our Indigenous communities and other diverse communities, as well as to your specific setting, because some of the research that does inform some of these ideas, it's been done a lot from a Western mindset and in British and US samples and a little bit in Canadian samples. So it's food for thought, and I think very important for us to continue to do this work in our own communities and think about how the work can represent all of the children with healthcare needs that we serve. This is also educational and not clinical advice for any specific child or situation. And this talk isn't going to focus specifically on trauma today, although that is an issue that does, of course, affect many children and intersect with some of these other issues. But hopefully by the end of this webinar, participants will feel able to summarize some data about the accuracy of parental concern in identifying learning, development, and mental health difficulties, to be able to describe some processes that characterize how parents become concerned about their children's development, and to state some steps to take if parents are raising concerns about these areas. And just to sort of get our wheels turning, I have a few case examples and some polls. So if we could launch the first poll. Karev is a 7-year-old boy in grade 2 whose caregivers are concerned about his reading. And she says, I know Karev is a smart boy, but he hates reading. She says she knows it's wrong to compare him with his sister, but the sister was much more academic. However, his caregiver says, I don't have very much time to read with him, so maybe that's the reason. And she mentions that Karev's teacher said he would benefit from some extra support at school to catch up his reading, but he hasn't been referred for a special education assessment. So I know I have a lot of different people here with different titles and different roles, but just based on your own experiences and understanding, do you think that there's probably not a significant or diagnosable learning development or mental health issue for Karev? You're unsure if there might be a significant diagnosable learning development or mental health issue, or you suspect there may be a significant diagnosable learning or mental health issue? I'll give you a quick second to respond, and then we can see what people are thinking. Okay, I think if we could show the results. Okay, so there's a couple people who think there's probably not an issue, a couple people who think there probably is an issue, and majority of people are really unsure in this scenario. So moving on to our next case. You can launch the second poll. Lila is a 12-year-old girl in grade 7. Her parents are concerned about her mental health. She mostly wants to be on her cell phone texting her friends, and when her parents try to talk to her, she tells them to leave her alone. There's a line here that got missed too, that she doesn't want to talk to her family at dinner time, and she's more quiet than usual. And one night she comes running into her parents' room and tells them she feels like her heart's racing and she can't breathe, but otherwise she hasn't really said too much about how she's feeling. So based on this information, do you think there's probably not an issue, you're unsure if there's an issue, or you suspect that there may be a significant or diagnosable issue? Okay, let's see what people are thinking. Okay, interesting. So in this case, we had a few people who really didn't think there was an issue. We had a couple of people who were unsure, and then we had a lot of people who think that there may be a significant issue. Okay, let's move to the next case and the next poll. I don't know if the poll, there we go. Okay, so Ray is a 10-year-old in grade 5, and his father's concerned about his behavior because he says, the teacher called me and Ray isn't getting work done and he's underachieving. And the father says at home, Ray won't really settle down for dinner or to do his homework, and he does seem to get into some fights with other kids in the complex. But his father acknowledges, I'm not too worried about it. I was just like Ray as a kid and I'm doing okay. So based on this information, do you think there's probably not a significant or diagnosable issue, you're unsure, or you suspect that there may be a significant or diagnosable issue? Okay, let's see what people thought about this one. Okay, so actually, this is really interesting. Nobody thought there's definitely not an issue. A few people were unsure, and then we had a number of people who suspected an issue. All right, so our final situation, Jamie's a 4-year-old in junior kindergarten. Her parents is concerned about her social skills, saying she's not very good at sharing, and she gets upset when she can't have something that she wants. When asked if she thinks Jamie has an emotional or social problem, the parent says, I don't really know I'd call it a problem, but I worry about how she's going to make friends if she's acting this way. So based on this information, would you think there's probably not an issue, you're unsure, or you suspect there may be a significant or diagnosable issue? Okay, let's see what people thought about this one. Okay, so this one, a number of people thought there wasn't an issue. About half of people thought they were unsure, and then just a couple of people thought that this seemed like it might be a significant concern. All right, so let's keep these cases in mind as we talk about some data on parental concern. And just to frame the conversation, I want to give a bit of background on learning development and mental health needs in school-age children. So we know that these kinds of difficulties are very common and they often co-occur with each other. So children with really significant learning problems, like learning disabilities, could be about 10% of school-age children. Significant ADHD and behavioral disorders, again, about 10%. We have a large number of children who have specific language difficulties, so specific difficulties understanding what's said to them and expressing themselves. And this is a really under-recognized a problem that children can have. We have about 6% of children with a significant and diagnosable anxiety disorder. And we have 5 or 6% of children with specific coordination types of difficulties. And these are just some of the really common learning development and mental health concerns that we see. But the majority of these are under-recognized and undertreated. And some of them are particularly under-recognized and undertreated, such as language disorders and anxiety disorders. And this is a real concern because we know that a lot of these concerns are persistent across development for most children. So if children have learning difficulties, like a learning disability early in their schooling, even as early as grade 1 or 2, that can be very persistent. ADHD can be persistent. Language concerns can be persistent. And for some of the mental health types of concerns, having those concerns early can predict later concerns. And all of these things can lead to additional consequences and concerns and burden on the healthcare system if they're not identified and appropriately addressed early on. And so how do we try to recognize these needs? Well, one approach would be systematic screening. So that an example of that would be direct testing as in infant hearing screening. And another example would be to ask questions for caregivers or perhaps teachers or children, as in doctor's office kind of milestone check-ins. Teachers may also raise these concerns, and of course, parents might be the ones that are raising these concerns, and they're the ones that are following their children across time in 2 different systems, so different aspects of the healthcare system or the education system, for example. And parental concern is actually a very, very common. So even if you just ask parents a general question, like, do you have concerns about your child's behavior, development, or learning? About a quarter of parents or more might raise some concerns. And we don't have as much good data on mental health concerns, but there's some suggestion that these mental health concerns would be even higher. The wording of concern is actually really important in this conversation. So the specific phrasing of concern is different than a phrasing like, do you think your child has problems, or do you think your child's below average, which parents might not be so likely to present. And so concern is a really kind of specific language. And we do want to think about how the wording of concern is interpreted in different cultures or groups. And it does seem that a number of different groups interpret concern in a fairly similar way. But there was, for example, a study of Chinese families where a very vast majority of families endorsed concern. And so to really figure out if concerns are predictive, you have to use a slightly different wording such as worry. So you do need to consider the how this applies to different groups and populations. And you can elicit parental concern, or parents can raise that concern kind of spontaneously in different environments. So for us to know really what we need to do about parental concern when it's presenting in a healthcare environment or another environment, it's important to understand the accuracy of parental concern in identifying children's difficulties. And so, we all might have our own experiences or theories, like, parents are worried about nothing, or wow, parents really know exactly what they're talking about. But we can do some different types of research to understand this. And one type of research is to treat concern as a screening measure, and to use some statistics to determine how accurate it is in identifying difficulties. This is actually quite difficult research to do because you need a large number of parents in the community to respond to the questions. And then you need to give all of those children different tests to see if they actually do have difficulties. And we do really lack specific or definitive tests for learning and development and mental health problems. So it's hard to get that confident one-to-one correspondence between a parent being concerned and a for sure whether or not their child has a learning development or mental health problem. But there have been some studies conducted that give us some good hints about how accurate parents are. Although again, specific focus on wording around mental health is not as there's not as much research on it as around learning and development and behavior and kind of general emotional functioning. So can parental concern identify children with learning development and mental health difficulties? In other words, is it sensitive to these types of issues? And there's a lot of research suggests that in around 70% of the time or more, parent concern is identifying these types of issues. So parent concern is actually a fairly powerful way of figuring out and identifying children with learning development and mental health concerns. However, the flip side of that is that some children definitely are missed when you ask parents about concern, and that parent concern might be less likely to identify certain kinds of problems. So parents seem to be less concerned about younger children, perhaps thinking maybe this is normal or they'll grow out of it. Parents seem to be less concerned when their children have more isolated learning problems or language problems. So for example, they have difficulty expressing themselves, but they're not really having difficulty reading, or they have difficulty with reading, but not difficulty with math. And then parents may be less likely to pick up on and become concerned about more internal problems like anxiety versus more observable external problems, such as behavior problems or signs of ADHD. However, it doesn't appear that parents are under concerned or missing issues based on some kind of demographic factors about the parents or the children. So parents are more likely to not be concerned about girls, or more likely not to be concerned if they come from a higher socioeconomic background or a lower socioeconomic background. However, the way that we ask concern and the language that we use does influence whether parents report it or not. And parents of certain groups are maybe less likely to share their concerns with providers, although they may have those concerns if you do ask them directly. So we know that parents become concerned and it can identify a lot of problems. But our next question is, okay, if a specific parent is concerned, what's the likelihood that their child is going to have some kind of significant or diagnosable learning or development or mental health problem? And there's a few studies which help us to give some insights on this issue. So the first is a study that actually myself and some colleagues conducted, and I do want to say thank you to them because their research has also sort of influenced my ability to get into this area. So we asked a number of parents, have you ever been concerned about your child's ability to learn to read? And then tested all of their children, whether or not they were concerned, with a word reading test. So a test of, do they have a good bank of words they can recognize? Can they sound out words well? And in about 45% of cases, if the parent was concerned, their child had some clear evidence of reading difficulties, the kind which would make it very difficult to keep up with the classroom expectations around reading. So almost 50% of the time, parent just said, yeah, I have some concerns, and this child has a very measurable word reading problem. We also have studies looking at if parents just say, do they have any concerns about learning or development or behavior? And in these cases, almost 50% of kids are failing developmental or social emotional screening tests, and a quarter of them are qualifying for like a very rigid criteria, very stringent criteria around whether or not they meet special education eligibility criteria. And if parents respond to a question, do you have any concerns about how your child behaves, with a yes, then around 41% of these kids had very, very significantly elevated behavioral problems by parent report. So what this is kind of hinting at is, if you ask parents about their concerns, it could be maybe up to half the time that there's definitely some kind of problem, and quite a severe problem or a diagnosable problem. And we have to keep in mind the limitations of how we measure the problems, right? Because if we measure the problems with one test or another test, or one criteria or another criteria, it is possible that kids would have other diagnosable problems or fail other tests that we didn't give them. So that number is probably even higher. Another really interesting study worded things slightly differently by asking if children have emotional or behavioral problems or hyperactivity. And again, parents are less likely to report problems than to say they're concerned. And in this case, almost half these children met criteria for a diagnosable psychiatric disorder. So we have like a pretty good chance that if a parent is concerned, maybe about a 50-50 chance or higher, that their child is going to have some kind of significant or diagnosable issue. And that might be even higher if the parent is reporting multiple types of concerns. So they're saying things like, yes, I'm concerned about how she's doing socially, and also her mental health, and also her learning, or I'm concerned about his behavior, and I'm also concerned about his development. If parents are reporting stronger levels of concern or higher levels of problems, and if teachers or other professionals are kind of agreeing with parents and are also concerned, that the chance that this child actually does have a significant or diagnosable issue could be a lot higher, maybe even over 70% or more. So on the flip side of this, though, we do have some parents who are saying they're concerned, whose children aren't meeting our test criteria that we chose for a diagnosable or significant problem. And so the question is, are these parents just kind of missing the boat completely? Are they just big worry warts, or, they don't really get what's normal? Or do these children actually have some different characteristics than children of parents who aren't concerned? And actually, a number of studies are very consistent in suggesting that when parents are concerned, but the kids didn't meet our criteria for the diagnosis or very severe behavior problems, these children do still have some problems of a more subtle nature. So these kids have worse scores on IQ tests or reading, writing, and math tests or language tests. They have double the behavior problem scores, or around double the mental health problem scores on measures of mental health or behavior. And that there aren't seeming to be really extraneous kind of demographic factors that are influencing parents' concern. So it's not, mothers versus fathers, or it's not the child is a boy or a girl, or the family is higher SES or lower SES, or necessarily different cultures that are leading to these over concerns. It's more seeming to do with the characteristics of the children, which is suggesting that for a lot of the cases where parents do even seem to be over concerned, and we really end up that we can't find any diagnosis, these kids still do perhaps have some meaningful problems or some meaningful needs in terms of their mental health or their learning or their development. And so all this to say that, in fact, it does seem parental concern can be really, really helpful in identifying these issues, and parents are quite accurate. So we want to know, how are parents becoming concerned? What are they using to figure this out, that there might be an issue going on? And so taking some of my own research with parents who are concerned about children's reading development and putting it together with some research on parents' concern about other developmental areas, there are some common themes. And so one of the themes, which I think wouldn't surprise most people here, is getting some feedback from other people. So for example, hearing from the teacher, this kid is not doing so great with reading, or they need some extra help with math. He seems behind compared to his peers. Or getting feedback from professionals or other family or friends. But an interesting piece of information is that this feedback can actually increase parents' concern, but it can also decrease it. So parents might think, her reading isn't really coming along. Then they go to the teacher. The teacher says, don't worry about it. Grade 1 students always need some extra time. He's very active, he'll grow out of it, kind of thing. Or they go to a doctor and say, I'm really worried about her behavior. And the doctor says, kids have behavior problems, just give it some time. So feedback from other people can influence concern by increasing it and also by decreasing it. Another big factor that seems to influence how parents become concerned is the comparisons that parents make. And a very obvious one, which again, I don't think is surprising, is parents comparing their child to a peer or a sibling, and saying things like, I know it's wrong to compare, but she just seems to struggle more with this than her brother. Or I watched him at the school concert and all the other kids were singing. He was sitting there kind of quietly in the corner. So parents make comparisons to peers. And that seems to be a really big influencer of how parents become concerned. Parents also might make comparisons to some kinds of standards of what they think is a normative or appropriate behavior. However, at the same time, there's actually a lot of research that shows that parents, and to be honest, myself, and I think a lot of professionals, have a hard time calling at a distance if certain behaviors are normative or not. So for example, you say to parents, at what age do you think your child should be able to count to 10? are we really going to be right on with what the developmental norm for that age is? And so when you talk to parents, there's a lot of confusion, I think, as well about what is normative and not. So if they think, oh, it seems kind of normal, they might not be as concerned. If they think, oh, that really seems abnormal, then they might become more concerned. A couple other interesting ones that are maybe less talked about is that parents do also seem to benchmark their children's own progress. So for example, saying like, last year he was really having these tantrums and they don't seem to be going away. Or conversely, he was having a lot of tantrums last year, but his emotional development seems to be getting better. So they would benchmark their children's own sort of skills off their previous version of their emotions or behaviors or development. And in certain developmental areas, parents will also benchmark certain skills off of other skills, it seems. So for example, they say, like he's really good at reading, but he's really not doing well with math. Or, yeah, you know what, she's so social, but she really has trouble, following through on tasks. So they can compare strengths in certain areas, and that helps them establish that other areas are a challenge. And a final thing that seems to influence parental concern, which I'm not sure is as sort of picked up on in the literature, is that parents actually are noticing children's emotional and behavioral responses to certain situations, or sort of how they're doing functionally. So an example of that is, parents are becoming concerned about things like children's motor development, or children's avoidance, or children's reading, because they're noticing that their child gets upset or distressed or avoids certain situations. So for example, she seems to really avoid taking showers and gets very upset by that. Or she seems to really be upset when I try to read with her. She doesn't like to do that kind of a thing. So parents observing kids' emotional and behavioral sort of approaches to certain tasks or situations gives them some information that may influence their concern, again, either in a positive or negative way. So yeah, she seems to actually like it a little bit, she's okay with it, or wow, she seems to really hate that and avoid it, and that seems like a problem. However, at the same time as parents are taking in all this information, trying to piece everything together, they articulate a lot of doubt and uncertainty, and also provide a lot of alternative explanations for why they think these things might be happening. So parents would say things like, I don't know if it's normal or not, maybe it's actually normal behavior, or maybe this is just a phase, it's a bad year, or they're going to catch up. Maybe I'm just too much of a worrier, or I'm making a big deal out of it and there's nothing there. And also parents will sometimes blame themselves. Like, I think it might be that I'm not reading her, or reading with her, or I haven't really been taking him out to the park. So that makes sense why, maybe he's not playing well with other kids. I haven't really had time to help him with those things. However, despite the fact that a lot of parents seem to raise these alternatives and this doubt, it doesn't actually seem to suggest that these concerns aren't valid. So parents raise the doubt alongside the concerns, and the concerns are still predictive of difficulties. And so it's not necessarily a good indicator of whether the concern is valid or not, the fact that parents are raising all these alternative reasons, or kind of figuring out if it's a real concern or not a real concern. So another kind of interesting topic with respect to this area is whether specific types of concerns clearly suggest a problem or a specific diagnosis. And in the learning and development and mental health behavioral world, parents can observe and present a lot of different types of issues that actually are not extremely predictive of specific diagnoses. So parents might raise concerns like, oh, she doesn't express herself well, or she's got trouble getting her ideas out. That could be like a language problem, but it could be an intellectual disability. It could be anxiety, like she's too anxious to express herself. Could be ADHD, like thoughts are coming out all jumbled. So it could be autism, like I'm having difficulty communicating and initiating communication. So the kinds of very common presenting concerns and problems, actually, at this point, we don't have a lot of great research that says if this problem, definitely going to be this diagnosis. Although I think there's increasingly sophisticated approaches to try to see if any specific problems are more likely to really indicate a certain diagnosis. And we also do know that a lot of these concerns or behaviors are common, and particularly at certain ages. However, other concerns or problems actually are quite unusual and atypical. And again, research is continuing to sort of unpack what might be some of those things that are very clearly signs of something that is off. And so an example of this would be children's tantrums. So, we would have lots of kids, lots of kindergarten kids who are having tantrums. Some of them might be having a lot of tantrums. And so just a parent who says my child's having tantrums is not necessarily concerning. However, can we sort of hone in on through some specific research techniques what types of tantrums or how severe tantrums does it have to be to really indicate a significant or diagnosable issue? And so, for example, in this study, they found that lots of kids have tantrums, but if these tantrums are occurring in an unexpected context, so for example, with an adult that's not the parent, or for no clear trigger, or if the child is becoming very dysregulated during the tantrum, so just going and going and going and going until they exhaust themselves, or breaking items, or hurting, like destroying things, then these sorts of things would be very developmentally abnormal, and that would suggest a clinically significant or diagnosable issue. And with respect to children's mental health, there's actually a really helpful, I think, study and action toolkit around signs that really suggest a need for immediate a mental health referral. And so this is a list, and you can refer to this toolkit and learn more about it online. But there are some behaviors that are clearly not typical and do suggest a mental health problem. And with respect to something like worries or fears, which is common, again, in children, if these worries or fears are getting in the way of daily activities, so this child is so anxious or nervous that they're not going to the birthday party, or that they're reluctant to go to school, or that they're not able to do activities with the family because something about that's making them anxious, that would be sort of an actionable mental health sign versus just child is nervous or child worries about things. Similarly, when we're thinking about difficulties with concentrating or staying still, which we know lots of kids might not always be concentrating or might not always be controlling their bodies, a clear sign of an actionable issue might be that these difficulties cause danger to the child, or school failure is another sign that's definitely sort of hitting a threshold of possibly a diagnosable mental health concern. And there are some other signs as well, such as having signs of a panic attack, or the child being very withdrawn for a period of more than 2 weeks, or having really out of control behavior that could be hurting themselves or someone else. So what are the implications for practice? Some of the implications for practitioners in our system are first, to ask for and listen to parents' concerns. Second, to act if you suspect a problem. The third would be if you're unsure, don't defer. And the last is if you hear parents expressing doubt, to tune it out, and not to tune out parents, but to recognize that those expressions of doubt or alternative explanations are not necessarily strongly indicative of their concerns not being valid. So what we can take from some of this data is that it really suggests that if we're systematic about eliciting parental concern, we're going to identify many more children with learning and development and mental health needs than are currently being identified. And if a parent is concerned, we need to really seriously consider if that concern is leading us to a potential issue, rather than being prone to be like, well, that doesn't sound like that much of a big deal. Because what the data is suggesting is that, probably there's at least 50% chance that it's diagnosable. And then with other features, that number could go quite a bit higher than that. So we don't want to dismiss concerns quickly. We really want to listen to them and take them seriously. At the same time, we can't rely only on parents to identify learning, developmental, and mental health needs, so there is a need for systematic screening. And so some of the factors that might really hint towards suspecting a more severe problem is first, if the concerns are severe. So if the parent's like, yeah, I'm a little worried about the social skills, or, oh, her learning, not so much, maybe it's a concern, versus, I really think there's a reading difficulty, or wow, like her social problems are a big problem. So if there's any indicators of parents expressing severity, which parents are not necessarily inclined to say that things are a big problem, then that would be something to take pretty seriously. If you see any of those unusual or atypical behaviors or indicators, that could be another thing to watch for. So for example, those action signs for mental health. And I do think as the research continues to evolve, there will be more clarity around what is really atypical and predictive of difficulties and what isn't. As well, if the parents are presenting several concerns or multiple concerns, then that would be something to really raise the red flags, as well as if the concerns have been persistent. So it's not just, yeah, I'm a little worried about his social skills right now, but I've been concerned about his social skills for a year or several years. If you're seeing clear emotional or behavioral impact in the child, so the child is avoiding things or distressed about things, as well as if the parent is able to make clear comparisons to other children, or to a norm that we would think would be relevant, or to children's other abilities in other areas, for example. And then certainly if teachers or other professionals are also concerned, that really raises red flags for a potentially more serious or diagnosable issue. The flip side of this is if you're not sure, I would really suggest not deferring. So a wait and see approach is very common, and it delays access to this essential early intervention, and it can cause a lot of distress when real concerns are present and confusion. So I would sort of suggest that if someone is unsure, you can do some further screening. You could consult the research on what is actually normal or not, and refer or consult with another expert if it's a little bit outside your comfort zone, rather than thinking it doesn't really sound that serious to me, so I'll kind of leave it alone. And luckily, there is some really great free, brief mental health screening tools that take very, very short time to administer and can quickly tell you if the kinds of behaviors that parents are raising concerns about are actually of a sort of unusually high or significant degree compared to other kids the same age. With learning and development, it's actually a little more tricky, because for kids under 5, we have a lot of great screening tools, because there's a knowledge that we have to try to identify these kids early, maybe before they get to school. So in the US, they've actually revised all the developmental norms from ages 0 to 5 and have really tuned these up scientifically. So they're a lot more able to differentiate between normative development and possible difficulties. And there's, for example, a free developmental screening instrument called the Survey of Wellbeing of Young Children for kids under 5 that could be used to screen development. However, it's trickier in older children because we don't really have a systematic approach to identifying these kids. And it often falls to schools. And I think healthcare professionals think, oh yeah, okay, the school's going to take care of this. But schools actually have more of, in a lot of provinces, a special education eligibility mandate rather than a fully screen and identify learning and developmental concerns mandate. So these kids tend to get bounced around schools, maybe to developmental pediatricians or to other allied health like psychology or speech language or OT or physio or different professionals, and get kind of a piecemeal approach to the learning and developmental concerns at school age. So we don't have as many great tools, and I think there's a lot of room for development in this area. We also know that parents are going to express doubt, but we want to tune it out because it's not really going to tell us whether or not these concerns are valid. So with these pieces in mind, maybe we can revisit some of the case studies and think about what, with this knowledge, if that would at all affect how you would be responding to these situations. So our first scenario, again, you can launch the poll when you're ready there, is that Krev's a 7-year-old boy in grade 2 and his caregiver is concerned about his reading. She says, I know Krev's a smart boy, but he hates reading. It's wrong to compare with his sister, but she was much more academic. However, the caregiver says she doesn't have as much time to read with him, so maybe that's the reason. She also notes his teacher said he would benefit from some extra support at school. So I'd be very curious to hear what people are thinking, whether this is probably not an issue, you're unsure if it's an issue, or you suspect that there is a significant or diagnosable issue. And I'll just give a couple seconds. Okay, maybe let's see the results. Okay, this really does warm my heart because my area of most research is reading. And in the early poll, a lot of people said they weren't sure. And a number of people said they thought there wasn't an issue. And certainly I would at the very least be unsure, but in this case, I do think that it's actually pretty likely that there's a significant or diagnosable learning disability of some kind. One, we just know of a parent's concerned about reading, 50-50 chance they're going to have word reading problems. They may also have other language problems or ADHD that would affect reading. And there's a lot of signs that this is a very valid issue in terms of suspecting a problem, right? So we have a parent who is saying he's a smart boy, but he hates reading. So there's a comparison to his other skills. She's made a comparison to his sister. And also we have a concerned teacher. And so again, we don't want to be too fooled by how mild parents are phrasing things or these doubtful alternative explanations. And we actually do know that for kids with reading difficulties, you can identify word reading difficulties very reliably by grade 2. These absolutely need the earliest intervention that we can provide, and they are not going to go away with time. So this is a kid who I think could easily present as like a wait and see. And in fact, in my mind, is definitely needing some further assessment, and there's a good likelihood that there's a real issue here. So let's look at the second poll that we could launch. Lila's a 12-year-old girl in grade 7. Parents are concerned about her mental health. She seems moody and doesn't talk to her family. She mostly wants to be texting her friends on her cell phone. And when her parents try to talk to her, she just says, leave her alone. One night she tells them that she's suddenly feeling her heart racing and overwhelmed, like she can't breathe, but otherwise she's not saying a lot about how she's feeling. So I'm curious to hear where people are at now with respect to this case. And I'll give you a few seconds, whether there's probably not an issue, you're unsure, or you suspect. Okay, let's see the results of this poll. Okay, so I think this is a really interesting, turn of events as well. And I think if we look at overall her story here, we have concerned parents, so we want to take it seriously. The majority of things that parents are saying, I would say, like in and of themselves, would be very hard for me to call. She's moody, she wants to be on her cell phone. Okay, like a lot of 12-year-olds might be doing these things. She says, leave me alone. I'm not sure that's necessarily a clinically sort of clear problem. And so if it were those things, I would be in the category of unsure. However, we have this clear, unusual sign that she's displaying symptoms of a panic attack, which makes it much more likely that there is some kind of diagnosable mental health concern. And so in this case, I would be suspecting it, and I would want to refer her for further assessment or treatment. And at the very least, we would want to screen, I think, and it would be good to screen her because these types of concerns are internal and it might be harder for parents to identify. So in our third case, we have Ray, and we could launch the poll for Ray. He's a 10-year-old in grade 5. Father's concerned about his behavior because he says the teacher called, he's not getting his work done, he's underachieving. And Ray won't settle down for his dinner or homework, seems to be getting in fights with other kids. But he says, I'm not too worried about it. I was just like Ray and I turned out okay. So based on this information, we think probably not a concern, probably not an issue, unsure, or suspect. Okay, let's see the results for that one. Okay, Okay, wow, so we're at 100% now. And I would really agree. I would definitely suspect a diagnosable concern. There's a lot of factors here that are pointing to this. It's interfering with school, and it's possibly putting him at physical risk. I'm not really sure what the fights are exactly, but even if I took the fights out, I still think there's a lot of different pieces. We have several concerns. We have learning concerns. We have he's not settling down for dinner. We have the fights with other kids. And we have a teacher who's also concerned. And so all of this, I think, is leaning me in the suspect direction. And I appreciate that Ray's father is saying, like I turned out okay, but that's not the information that I'm going to most weight in terms of figuring out what I think would be going on. Okay, let's go to our next case. So Jamie's a 4-year-old in junior kindergarten. Her parents are concerned about her social skills and say she's not very good at sharing, and she gets upset when she can't have things she wants. And if you ask if the caregiver thinks Jamie has a problem, she says, I don't really know if I'd call it a problem, but I worry about her making friends. So do we think probably not an issue, unsure if there's an issue, or suspect a significant or diagnosable issue? All right, let's see what people had to say about that. Okay, this is an interesting split. And I actually picked this example to be really kind of very mild and hard to determine. So I would say I would lean towards the majority to be unsure. And I would say, like, we know a parent is concerned. So again, when the parent is concerned, do we just want to think, it doesn't really sound like that much based on what they describe, let's move on? Or do we want to ask ourselves, okay, like there's a chance it could be an issue. Maybe it's worth doing a little more screening. At the same time, there isn't a lot of those signs of suspecting a significant issue here, right? The concerns don't sound particularly severe. They don't sound particularly unusual. There isn't a lot of different concerns, although, they seem to be more a little bit social, maybe a little bit emotional. We don't know how long these have been persisting. We don't necessarily see huge emotional or behavioral impacts from this discussion, clear comparisons, or a teacher who's concerned. So I think I would lean towards the majority here as well in being unsure. And I think a really easy way to sort of check this out would be to give her one of these very brief mental health screeners. So the pediatric symptom checklist is going to screen for acting out behavior, internalizing behavior with 17 items. Same with the strengths and difficulties questionnaire with 25 items. We're going to have a good chance to see if the kinds of behaviors the parent is reporting are actually a lot more than other kids her age. So with some fairly brief screening, we can be a lot more confident. Does there seem to be something here that we, maybe need to follow up on? Or no, this just seems to be a parent who, wants her, maybe this kid does have a little bit of a problem, but not necessarily to the point of it being clinically significant. So we could more do a little bit of counseling or refer to some resources. So thank you very much for your participation. I hope this was thought-provoking. I did want to leave you with a couple resources that are sort of first stops for some of these different issues that are mostly free, although Coping Cat Parents is around $100 for an online anxiety treatment program. We have a free parenting course for ADHD from chad.org. There's a free behavioral parenting course, which is created by and sort of narrated by one of the biggest developers of evidence-based behavioral interventions. And we have some resources here on language disorders and also coordination difficulties. And for practitioners, if you're not already aware of this resource, there is a website on effective child therapy, more for the mental health types of concerns. And on that website, it talks a lot about what are the evidence-based treatments for different issues and how to get more information and training about those things. So thank you very much for coming and for participating. And I will turn it back to the team on the other side.
Thank you, Katelyn, so much for this engaging presentation, as well as those great resources. I'm sure there are many on the line who are grateful for them. I see we have a few questions that have come in. I'm going to take a moment to get them sorted. And while I'm doing it, we'll ask you to fill out a few quick poll questions. Hope you're not all polled out by now, but you'll need to answer all 5 questions before submitting a response. While you're responding to that, Katelyn, I'll pose a couple of those questions. Susan has asked, any thoughts on or comments on social media trends impacting parental report of concern and how to manage this clinically? And using the example, trends on TikTok about symptoms of ADHD or OCD, for example.
It's a really great question, Susan, and I don't want to kind of like overstep the research in my answer. So I'll keep a bit of a food for thought. I think some of the things I would be thinking about are, one, like parents coming in presenting a certain diagnosis is not necessarily going to tell us if that diagnosis is really there a lot of the time. So just because a parent says, I think maybe he has autism, or maybe she has OCD, or kids are saying this, I wouldn't necessarily think, oh, wow, like that's for sure what's going on. So what I would more be thinking about is maybe some of these other indicators, like what are the actual concerns? How did they come about? Did they come about from some of the ways that we've talked about, like made comparisons, heard feedback from the teacher, saw that it was different than my other children, or those types of things? And then as well, if there's any of those other indicators that there's really a problem, like it's severe, it's persistent, there's some unusual signs. And maybe some of that might help point a little bit in the direction of, again, not thinking, oh, this is just TikTok, I'm going to ignore these concerns, but also, being able to get a little bit more of a fulsome idea. And then, of course, you have those screening tools for mental health, which may also, provide some other data about whether or not looks like there's something to pursue.
Great advice, Alex. Katelyn, Alex has asked, do you have any recommendations on resources that may help us, which you've shared, as healthcare professionals to word neuropsychiatric concerns to parents so they seek referral? I find that this can be a very sensitive area and would love to have more tips on how to do it.
That's a really interesting question, Alex. Maybe I'll just give you a second if you could unpack a bit via another question, perhaps, like what you mean by neuropsychiatric concerns. So maybe I'll give a second to type a little bit on that. And then if there's another question, I could answer it in the meantime.
Sure. We have another question that is, what is the earliest age you can assess a child for learning or social emotional problems? And are there any risks with assessing too early, and or the benefits to waiting for a certain age for a comprehensive assessment?
That's an excellent question, which I am for sure not going to be able to answer fully, but I will try. So with respect to learning concerns, I'll start there because I think there's a real misconception that we can identify learning concerns till grade 3 or grade 4 or later down the road. And there's actually a number of learning concerns that we can identify very early. We can certainly screen for learning concerns with like reasonable accuracy, even in kindergarten. But for example, by the end of grade 1, and certainly by the end of grade 2, especially for concerns like reading, like word reading, so being able to sound out words, recognize words, we can actually pinpoint with fairly confident accuracy by end of grade 1 if a child has word reading problems that are going to persist throughout their schooling. So I would say, do we have to necessarily do a comprehensive psychoeducational assessment at the age of grade 1 or grade 2? Well, no, and certain things like IQ tests might not be as stable at younger ages. However, do we want to wait to identify reading concerns, for example, until grade 3 and grade 4? Absolutely not, because the best period for intervention for those things is in grade 1 and grade 2. So for learning concerns, I think we want to be careful not to think that we must wait and we can't find them until a little bit earlier. With respect to social emotional problems, I think that we're getting increasingly more able to determine what is normative and not normative behavior at increasingly younger ages. And we actually know that kids at a very young age can have mental health problems, maybe can have developmental problems that you can reliably diagnose. So things like autism, even ADHD can be diagnosed, I think, younger than people think it can be. And so I think that there can be benefits to using really strong assessment approaches to identifying mental health and neurodevelopmental concerns at younger ages so that they get that early intervention. And it doesn't necessarily have to be diagnostic assessment, but a really, targeted and informed clinical assessment to determine if there's enough of a concern there to warrant intervention. Okay, so we're looking for recommendations on resources toward mental health concerns. That's a really interesting question. And I'm not sure I'm going to have a great complete answer right now, but I do sort of wonder about some of those motivational interviewing strategies and being able to elicit some of parents' own motivation for seeking mental health treatment. So parents might go back and forth on whether it's really a big deal or whether it's really worth seeking additional support. And, some of the motivational interviewing types of principles would be like having parents talk about their reasons for doing it or not doing it, and being able to amplify some of the reasons that they have for seeking referral or treatment that would allow them to sort of make that decision and recognize their own kind of motivations for getting that help, as well as I do think being validating of parents' reasons for not getting that help, which might be that they don't trust certain professionals or they don't want their child to be labeled. So being able to validate their concerns as well as elicit what their own motivation might be to support them if that would be a helpful referral.
Great, thanks so much. That's the end of our time together today. I want to thank you, Katelyn, for sharing your time and expertise with us and all those great resources. And thank you to our audience members for joining in. We know how busy you all are, and we hope you depart with some practical knowledge to bring back to your organization. Coming up on Spark Live on June 28th, we're excited to bring you another webinar, Collaborative Pathways to Engage Healthcare Professionals in Address Refugee, Child, and Youth Mental Health. And in July, we'll be releasing a podcast, Navigating the Child and Youth Mental Health Crisis, Challenges and Opportunities. And that episode will see Dr. Smart in conversation with Dr. Javid Sukera. During the summer months, we typically don't host our webinars and podcasts. So after these sessions in June, we'll see you back here in September. We want to wish you all a lovely summer. It's always great if you watch live, as your questions and comments really enrich the discussion. But if you can't, we record all of our sessions and make them available after the fact on our website and via our YouTube channel. Thanks again for joining us today. Thanks for Katelyn for this great presentation. And hopefully we'll see many of you back here next week. Bye, everyone.